This is Jambo Radio.
Hello everyone, good afternoon. Welcome to the Positive Health Hour. This is a new show on Jambo Radio, new exciting show. And we're going to be talking all things health, but when people, think about health, they think mostly about good health in terms of things like cancer or high blood pressure and looking after yourself in that regard. But one thing that is sometimes, left out, which is very important to all of us in one way or another, is sexual health. And sexual health is something that we don't talk about very much, which is what this show is going to be about. Positive Health Hour is going to be reflecting more on sexual health. One of these aspects of sexual health that we're going to be talking about a lot is around HIV, and HIV stands for Human Immunodeficiency Virus. HIV is something that we've, maybe known or heard about over time, since it was first discovered about 40 years ago. A lot has, happened at the beginning of when HIV was first discovered, and a lot has changed over time. But some of that information, some of those experiences have been, lost in transmission or sometimes not heard about. We're going to be talking all things HIV on this show, talking more about what HIV is, talking more about what living with HIV is, and discussing very many different experiences about things that relate to HIV. So things like accessing services, but also things like stigma, which is one of the things we'll be talking about today. Just a little bit about HIV. So it's a virus that attacks the immune system of the body, and that means it attacks the part of our body that fights off infections, fights off other diseases. And after a long period of time, if this virus is not stopped from acting in the body, then it means the body can acquire some diseases that it would not be able to fight off, and that can lead to things like cancers. Thanks to all of the medication that we have available, HIV is treatable now. It is not more something that is untreatable. With the medication, it means you can manage the virus, but there's still things that people experience when it comes to talking about HIV or living with HIV, and those are the things that this show is going to be exploring more about. And there's also a direct focus with the Afro-Caribbean community, that we belong to. My name is Ese Johnson, and I work with Waverly Care, who are the sponsors of this show. Waverly Care is sponsoring this show every second Thursday between 2 and 3 p.m. live on Jambo Radio. And Waverly Care is a charity in Scotland who, take a positive approach to talking about these issues of HIV, sexual health, but also initiating conversations with different communities in Scotland to explore this topic, talk about, what it means, around these different sexual health issues, and encourage people to get tested, for things like HIV, hepatitis B, and hepatitis C. So they are our amazing sponsors on this show. I work in Waverly Care as the development manager for minority ethnic health, but I am also someone living with HIV, so it's both a personal and a professional experience for me. On the show today, I have my very amazing colleague, Mariegold, and myself and Mariegold will be talking all things stigma, so I'll just hand over to Mariegold now to introduce herself before we go on.
Hello, my name is Mariegold, and I work with Waverly Care as well. My main role, I'm a health improvement coordinator, and my main role is to do the infant formula for moms living with HIV, and also support people for treatment and sustain them in care. My third role is to deal with, to support developing peer mentors. So we'll be talking about HIV stigma today as a topic. So I'm going to ask Ese what HIV stigma is.
HIV stigma. First of all, what is stigma in the first place? And it is something that we experience, but we sometimes do not know the word for it. And it's basically just when people are treated with a negative perception, when people are treated with negative attitudes because of the wrong belief of something they are or something that they might have. So, for example, when we're talking about HIV stigma, it is the negative attitudes towards people living with HIV or towards HIV in itself because of the wrong beliefs that can sometimes exist. Wrong beliefs that, like, oh, people with HIV, it's a death sentence, for them, or HIV can jump from one person to another in the air, or things like that. Those negative beliefs is what makes, someone then look at themselves if they are living with HIV and say, oh, I can't talk about it because I am a dirty person or I'm a stained person. No, that's a lie. Or, sometimes external stigma where people can say, oh, I don't want to talk to that person, or I don't want to relate to that person because they have HIV, they have this thing that will kill them and kill me too, which is a wrong belief. So stigma is that experience of treating people negatively because of that wrong perception, that wrong belief of what HIV is. Yeah.
So with that, to lead on, I'm just going to share some stories. I'll share first one and then maybe ask some questions. So I'm going to share one of the HIV stigma stories. So one of our clients some years ago relocated to Glasgow. There was a reason for that. She arrived from Africa and she stayed for some weeks and felt, she's getting comfortable with the family, and they lived together in Africa. So they were kind of hosts. And then she shared her status with one of the daughters of the family. And she didn't keep it confidential. She went about to tell the rest of the family. So the issues came about isolating cups that she's used to drink. The toilet she used, they will not use it. The place she used in eating, the spoons, the fork, the pot she used in cooking. It was just like isolation. Even they won't come close her. It's like she's dirty, as you just said. So it went on like that. And she felt, so she sought some advice. And another family friend said, okay, you could relocate if you want to because you're getting uncomfortable with the family. So that's where I will stop. If you have a question.
Yeah, that's exactly what was I was saying earlier. Is that like treating people differently? Would you treat someone else who has any other health condition like cancer that way? No, and that's because the wrong beliefs that people have about HIV sometimes, which we're going to be talking about more. So in this situation, how did this person, what did they do in response to the family treating them differently and negatively?
So she sought advice for one distant family relative, and they told her she could relocate. That would ease the kind of situation. Then she was going out frequently, and she went to other support groups as well in England for a while. Then eventually she relocated to Glasgow.
Okay. And relocated to Glasgow, what did she, because this is obviously an experience that you've come to know. So what has been the relationship between yourself and this person after they came here?
Yeah, so being health advice during that period, she was referred to me, meaning I used to go to the Brownlee and be a presence at the clinic. And so I met with her as well. Then kind of took issues from there and then brought her to the project, and she started attending support groups to see other people living with HIV, and then she was actually attending the HIV stigma support group as well, and she learned a lot how she can challenge further.
And that's very interesting because, like, for people who might not know the Brownlee Clinic, it's the specialist HIV and other bloodborne virus clinic in Glasgow. But it's very interesting that this person, coming to the support groups that you organize, that you put together for people living with HIV, they were able to understand, I'm a normal person like everyone else. I shouldn't be treated differently. And now they were able to challenge that experience. That's really interesting. Are there any other sort of experiences of stigma that people you've worked with that you know of?
Yes, there's another one. Another experience. One of the clients went to hospital because she was having a swollen leg, like having issues with blood circulation, and serious pain. So she went to one of the big hospitals in Scotland, and then she was admitted for over 3 to 4 hours. She was not attended to. And then it was like, why did I come here? Like, she was like rejected, and not as if no one is sitting down there, but she can see the same doctor attending to everyone in the ward. And so that kind of made her to be feeling very concerned. Stop them.
That's very interesting, and it's surprising, sometimes, especially in the work we do, when we realize sometimes some health professionals still do not know the up-to-date information about HIV. Like someone who is living with HIV on their medication cannot pass the virus to someone else if they have an undetectable viral load. But we've seen other experiences like that of doctors or dentists sometimes saying, oh, we don't want to touch that person till the end of the clinic so we can wear multiple gloves or things like that. So this person obviously had that experience. What did they do, in that situation?
So as she was patient, sometimes we have to be patient, not just talking like a drum and not achieving what you've gone there for. So she was patient and coming to 4 hours waiting. So she saw this doctor coming to do a world round and to hand over. So she called the doctor. And the doctor went near her bed, not getting close to her. I said, Doctor, can I have your name, please? I need to make a complaint because I see you be walking around, but because I'm HIV positive and you kind of avoided me. So I need to make a formal complaint. And the colleague that came to take over was like, oh, what is this, And eventually she was attended to right there. So that's how she challenged the situation. It was successful.
Yeah, and it makes a lot of sense because if you're living with HIV and I'm not a danger to anyone, I'm on my medication, I'm undetectable. Yeah. I am basically the same thing as everyone walking into the clinic. Why should I be treated differently? Yeah. And it's so interesting that this person stood up for themselves. They didn't just run away saying, "Oh, I've been isolated and stigmatized. That must mean I'm wrong," or and it's something that a lot more people hopefully will be able to take courage from and say, I will challenge that next time I'm in such an experience.
And she shared that with us.
Yeah. Just thinking, are there any other experiences that you've come across in your work?
A mom, because I do the infant formula. So this mom went to the hospital to have the baby, and after 2 days she had the baby. The nurses in the ward knew that she's HIV positive, and because of that, they didn't change her clothing, her bed, and her dressing. She was really upset, and I asked her if she could take it up. She said, my baby is there, and I don't know how they will feel for that. After 2 days, they've come to attend, but I really feel the pain. She shared, and I'll stop there.
And that's something sometimes, sometimes people live with HIV. It's not just about the reaction they receive. It's about the reaction their friends, their family, people who depend on them receive, which is something like this mother was experiencing. She didn't want her baby to receive bad care because of this person who did not have their updated knowledge of what HIV means. So what did this mother do anything in that situation?
Yes, she picked herself up and kind of like cleaned herself up and put her dressing gown on, and one of the people the assistant came to the ward, and she requested for change of clothing. Okay. And when they saw that she was changing the beddings, then they came to assist her. So it was fun. But
exactly.
Yeah, something they learned, isn't it?
Yeah. And in that situation, it's someone who doesn't have the right knowledge, being educated to say, touching someone else's clothing or touching someoe's body living with HIV, that is not a route of transmission. Like, do your job the way or live your life the way you would do with anyone else, and that way it's changing that negative perception, which we said is that negative attitude towards HIV.
Yeah, I think when you look at this topic, HIV stigma, most doctors who are not specialists, consultants, HIV consultants, they have no knowledge. Even those in NHS. And I remember there was a model some time ago that was actually designed by the NHS, which was actually used to be training people who are non-consultant of HIV, not working in the clinic as specialist nurses. So there are ways we can do this. Even the housing, because I've known that during my support, some people were disclosed, which I was not happy. I have to challenge it. So most people do not know the route of transmission. Isolating people using the same cups, isolating people, isolating the use of plates and pots. That's not the right way. Exactly. So we have more to learn and more to reach out to educate people.
And this lack of education or lack of awareness, it's not because people genuinely want to be horrible to others, or unfortunately, it's just because sometimes they don't have the information that's needed. So they are trying, they can be trying their very best, but it's about updating that knowledge and updating yourself, and not just within healthcare. Just generally as human beings, day to day, living our lives, walking around. There's about 5,000 people from minority ethnic backgrounds, which includes Afro-Caribbean people in Scotland living with, HIV. So it means, without even knowing it, we come across people on a day-to-day basis living with HIV. It's about how do we educate ourselves to make sure we don't relate to them in a negative way, because of something that we believe might be true, which is not, or which has changed over time. You've talked about these experiences of stigma, but I'm just thinking, and in my mind, I'm seeing connections of, this must have affected those people in certain ways. So, like, what can be the experiences of stigmatizing people?
So when people behave like that, to isolate people, to discriminate a bit about people, to kind of reject people, and kind of be silenced about, you don't know why somebody's carrying bag and medication and traveling. What happens is that it actually has impact on their lives, has psychological kind of pressure, and also can lead to HIV stigma and self-stigma, and even some form of isolation. People can go isolated. People can go very lonely. And people can go emotionally down. They can be frustrated as well. There could be sadness that, oh my God, why have I been treated like that? I don't have a disease, I'm living and I'm undetectable. Why am I treated like that? Some of them will live with anger, like really frustrated. You can see the anger coming out. Self-stigma that I don't want to even go anywhere. I don't want to even go to the clinic. I don't want to take any medication. Some people have actually left their medication for days when things like this happen. And it can lead to social network breakdown. You are in that network and you are in that community, and even families, you can lead to withdrawal as well. This is a dangerous thing we are talking about. It's how we manage it. In turn, it can lead to how you cope with the strategies you have. That's like it's just taken away from you, snapped away from you. And people in the whole turn, you can see a downturn to treatment and living care. So this is why we offer the support to make sure everyone is living well. And if you have issues, we can discuss it and bring it to a support group and we can talk about it. So we can help each other.
And that was actually going to be my next question to you, because you work in the African Health Project supporting people of Afro-Caribbean heritage in Glasgow and Lanarkshire. So I was just going to ask, what does Waverley Care do to support people, whether before, in terms of information provision or people living with HIV? What does the charity do?
So we support them. If information come, we pass it on, and information come, we can take it to the support group and tackle it with, as a worker, put it out so that we can tackle it and use it as a topic. So we can have, like, when even information like the vaccine came, we had to discuss it because people were thinking, if I take the vaccine, I'm going to die, I'm going to be alive. What's going to happen? Then we looked at the kind of pluses of taking the vaccine than not taking it. Because if you don't take it, it's like the vaccine has come to stay. So the coronavirus has come to stay. And if it's come to stay, what happens is that we need to kind of take the vaccine to live well instead of avoiding it. So that was a good information we shared. So this is how we run this support. The topics are not just created by me. We bring the topics when they come, like God never writes anything to us. We put it out to the people and say, okay, we need to discuss it. Does it touch you? If anyone is impacted by this, we can discuss it. Even mental health issues. Because somebody is discriminating against you and doesn't know the route of transmission, it can cause really high mental health issues. So we take that very seriously.
Okay. Just at this point, we're going to see if people have questions for us, or comment in relation to this topic. So you can phone in live, to ask your questions, to express your views, drop your comments. The number is 0743 7826 865. Just again, the number to call in live is 0743 7826 865. You can also drop a comment on all Jambo Radio's social media platforms, Facebook, Instagram, at Jambo Radio Scotland. Let's just see if anyone has any questions for us.
Hi, I've got a question.
Oh, hi, you've got a question for us. Yeah, ask away.
Okay, I just want to find out what is the impact of stigmatizing people living with HIV?
Yeah. Marigold, do you want to take that? The impact of people being stigmatized because of HIV?
Yeah, sometimes people can be isolated, and sometimes they can withdraw from treatment, and they don't want to talk to families. You don't know whether they have issues. And what's happening is that they might even break away from their network of support. It's really a hard one. And they can have mental health issues as well. That's just some of them. So it's really, if one is stigmatized, really need to discuss with somebody and bring it to a support group or look for support. Mental health support as well. And just normally do the referrals as well. Yeah,
and just looking at, like, we're human beings, we're social animals, we need social connection, we thrive on social connection, and that point of isolation especially is very important, because then that leads to someone thinking of themselves in a negative light, you know, because they're living with HIV, which shouldn't be. I don't know if that helps to answer your question.
Yeah, it does, really. Thank you very much. I've got another question as well.
Oh, you've got another question. Yeah, ask away.
Okay, thank you. I just want to find out what are the roots of HIV transmission, and also part B of my question is, are there any myths around through which HIV cannot be transmitted? Because really people need to know, because some people they think if you touch a cup that somebody who is infected, it will automatically infect you. So I really want to know, what are the myths around the transmission? Thank you.
That's a good question, because, you know, we've been talking about HIV transmission and how it cannot be, but we've not really expounded on the actual roots of transmission. The roots of HIV is a bloodborne virus, which means it transmits from one person to another through bodily fluids. And the bodily fluids, you know, are either blood, semen, so that's sperm or vaginal fluid, anal mucus or breast milk. But those are the roots of transmission in terms of how it moves from one person to another. But also there needs to be a type of contact. But that contact is not just skin to skin contact, which is, you know, like you've said, the myths around. People think, oh, if you touch someone else's skin, someone else living with HIV, you get it. No, it's only either transmitted through direct blood sort of contact, which can happen during blood transfusion, or, you know, maybe during sexual intercourse, exactly, or, you know, using for people who might be injecting drugs, you know, maybe sharing the same injecting drug equipment. But unfortunately, there's some beliefs that if you use the same toilet as someone living with HIV, or you use the same cups with them, or you touch their saliva, or their saliva touches you, or their tears touch you, or their sweat touches you, you can get HIV. And it's like, no, that's not the route of transmission. It has to be through blood, vaginal fluid, anal mucus, semen, or breast milk. And there needs to be that sort of direct contact between, you know, the two fluids of this person. So like we said, maybe during sex or you know, blood transfusion. But that's even something that now is different in slightly, because there's the medication for people living with HIV. So what that means is, when someone is taking their medication and the virus in their body is not detectable, it cannot be easily, you know, screened in a test. That what it means is they can't pass the virus on to someone else. So even if, you know, they are breastfeeding, which, you know, is something that some people choose to do, they can't pass the virus on. But also the infant formula program that Waverley Care offers, why we have that program is because the Scottish government, the recommendation is mothers living with HIV, you know, they recommend that they should most likely use the infant formula milk to feed their babies.
So I can expand as well. I think some years back, the UK government did a research, because people living with HIV, they are struggling with access to courses, and how they can be nurses, they can be doctors, dentists, surgeons. So this research came, I think, when David Cameron was there. And research came and said it's like zero transmission with cuts, zero transmission with kissing, hugging, all that we eliminated. So most of the people we know who were with the project, initially I started 2009 working with Waverley Care. Most of them are nurses now, and most of them have gone to do to be dentists as well. So there is access to kind of high courses that they thought if they go there, they are surgeons, they can cut each other. So that research really proves it. And it was a breakthrough that actually now gave opportunities for those living with HIV to do better courses.
Yeah, so hugging someone with HIV, no transmission. Kissing someone with HIV, no transmission. And imagine, it's like, sometimes it's like experiences that we've deprived ourselves of because of that fear. And it's about challenging that fear and saying, no, that's not the route of transmission. This is what it is. Thank you very much for your call. I don't know if you have any more for us or...
Not really. I think I have been helped, really.
Oh, that's great.
Thank you so much.
Thank you so much for calling in.
Thank you so
much.
much.
Have a good day. Bye.
Thank you. Bye.
Yeah, if you have any more questions for us, anyone, definitely give us a call. Yeah. Welcome back. It's Positive Health Hour. We've had a few questions coming on WhatsApp, so I'm just going to read them out. So one of the questions is, what does Waverley Care do within the communities in Scotland to tackle HIV stigma? Mariegold, if you could help us with that question. What does Waverley Care do to tackle stigma?
So yeah, we're visiting communities. We're reaching out to communities to raise HIV awareness. We're doing HIV transmission workshops so that people will actually know the route of transmission. There's the light. If you know something, you know that you'll be able to ease yourself to kind of welcome those living with HIV. So we actually tell them the route of transmission. This is how it happened, through sexual intercourse, through this, through that, through breast milk. So we do those workshops so that people can actually have opportunity to ask questions, to learn, to know more. We educate them on the route on HIV transmission, which I've just said, the facts, and try to take these cups away, the myths away, because those are not the ways the HIV is transmitted. If they know, they will be able to support those living with HIV as well. And then we use there's a leaflet that we use, the African Health Know Your Status. This Know Your Status is some people will go in the community and say, okay, we don't want to test because of our religion. We have tested before, or for 2 years, 3 years, we did nothing. I'm a Christian, I don't do anything, but we want to say, how do you know your status? So that, like, do you know whether you're HIV positive or not? And you're discriminating against somebody. So because of that, that really encouraged them to test as well. So we explain the you to you equal to them as well, to say if somebody is HIV positive and the person is taking medication and has undetectable viral load, there's no way this person can pass HIV to you, because what's happening, the HIV is present but non-active is just there in the system, in the blood. So we kind of educate them on this, that it's unable to transmit. Then we if anyone or relative is HIV positive, and maybe the partner, either the man or woman, is not positive, do you have access to PrEP? We tell them how you can get the criteria, and if it's too hard, we kind of consult where we know to consult to the clinic to see that they have this access. We also encourage them to test on time, because testing on time will prevent you from late diagnosis. So we don't want to test, and a few people I know have unfortunate, but we don't want that to happen. So we encourage them, if it's too late to test, these are the things that happens. It's not a threat, but we are telling you the fact. So that really kind of encourage them to test. So we do sexual health and condoms as well. Few people will say, we pick here, we pick there, or we don't use condoms. We still educate them. Then we encourage our peer mentors as well to talk to those who are diagnosed and how they can keep going, not to kind of avoid the stigma. Start build your self-confidence, keep confidence up as they have lived experience. They can share so that these people will be confident enough to say, okay, if I would disclose to my family, I don't disclose, this is the right time to do it, this is not the right time. So the community can come up and with the support instead of discriminating against those living with HIV. So Waverley Care is doing really good work. reaching out to people.
There's a blanket of services that Waverley Care offers, from prevention, providing information about HIV and other bloodborne viruses, and just sexual health generally, so people know the facts and they know, the routes of transmission, but also providing opportunity for testing, like you said, providing opportunity for people to test frequently, not just once, but multiple times, making sure they are constantly checking, where they stand in terms of their sexual health, and then support for people who might test positive for HIV.
We used to just do the HIV test, but now NHS have agreed that with the stream of funding, NHS have agreed that we should do the HIV, the hepatitis B, and the C. So that's a complete raw check, because we have found out that some of the people from Afro-Caribbean communities have kind of had Hep B, and then there was a queue along the line because we live together. That's the criteria. So that's a kind of access, open opportunity for hepatitis B to kind of get in. So some of them will find that. So we use that as well, that we found that some results that have come, and there was hepatitis B but went away, and some of them we need to treat. So where are you? Do you know your status?
Exactly.
And that really encourage people to test, and so that all of us can fight this stigma together.
Yeah, and I think that's a powerful thing, that if there's an action that everyone needs to do, it's know your status, get tested, and just thinking, it's like, what are the options? One of the questions that came in, which closely aligns to what you just said. What are the tests? Where do people get tested in the area? What do people do to be able to get tested?
It's free. Test is free. You don't need to do anything. Just sometimes you book appointment, you can drop in. Our office in Glasgow is 19 Waterloo Street. So it's easily accessible from the central station. So buses come around there, underground, if you're coming with train from somewhere you want to test, just come in, drop in. You can drop in. If you don't see anyone, give a phone call to the landline, and one of the buses or one of the staff will pick it up. And we have our mobiles on the website as well. And on the website, all staff have their mobiles displayed. And if you want to book a test, you can pick up a number there and phone. And we are really working as a team to get people tested. So we are there all the time.
Yeah. So that it's very easy to find out so much more information about Waverley Care, and also get in touch with the organization and get in touch about things like testing. Our website is www.waverleycare.org. That is WAVERLEYCARE. www.waverleycare.org. And on social media, we're also available on Twitter, on Instagram, on Facebook. On Instagram, we're available at Waverley Care. On Twitter, same thing at Waverley Care, and on Facebook at Waverley Care fan page. So you can find out more information about what we do, about the services we have available, and if you want to book onto a test. But also around Scotland, there's so many sexual health clinics within the areas, and even some GPs. Some GPs provide sexual health testing and sexually transmitted infection testing. So definitely just pick up a phone up your nearest sexual health clinic or your GP and find out what testing options are available. We have one last question that's coming, and this one is in relation to sorry, I'm just trying to see the question, because I'm not using my very, very good contact lenses today. So you've talked about normalizing testing. We've talked about normalizing testing as a way to tackle HIV stigma. What else is available currently to prevent against HIV? That's one of to prevent against transmission of HIV. That's one of the questions that have come in. And I would just like to say quickly, so like I said earlier at the beginning of the show, I'm someone living with HIV. I've been on my medication since about since when I got diagnosed, and I've achieved I'm undetectable, which means I cannot pass the virus on to anyone. So the treatment for HIV in itself is a way of preventing further transmission, and so that means people living with HIV get on their if they get on their medication, it means once they are undetectable, they can't transmit the virus, they can't pass the virus on to anyone else, they can and I take 2 pills a day, 2 tablets a day. Sometimes I don't notice taking the tablets because I'm like, have I taken it today? It doesn't really affect my life. I wake up in the morning, I take my 2 tablets a day, take my vitamin D tablets, because as we know, coming from Africa, I need all the sun I can get, but you don't get so much of that in Glasgow. So I take my vitamin D tablet alongside my HIV medication. It doesn't even like it doesn't impact on my life. But there's also other things to prevent, transmission of HIV. We've talked about condoms, using condoms, and it's not just HIV, sexually transmitted infections generally.
Other things.
Exactly. And there's also PrEP, which is pre-exposure prophylaxis. And I know you mentioned that earlier. So do you want to give a little bit more information about what PrEP is?
There are criteria. So just because if one person is positive, another one is not, it's important to have that, because there's another experience when a mom is pregnant and it's not positive. We did give the infant formula because NHS authorized it, but then she got the PrEP. She's not the HIV person, but she got the PrEP to prevent that, because a pill you take on a daily basis that if you sleep with somebody with HIV, just by mistake, maybe transmission took place, that PrEP just dissolves it. It's just instant. So it's very expensive meds. So it's to protect the mother with that unborn baby, to make sure while she's taking her ARVs, she still take the PrEP. So immediately that dissolves, and then there's no access. And I saw this really worked with my experience, apart from just reading it or workshop or training we had. I saw this actually happen to a family, and it's a good thing, because good thing the NHS is doing, because if that is not done, then that baby eventually gets HIV, which is not the right thing to do. So that really works. Just there are criteria to meet. So if anyone is in that kind of state, and you feel you've tried and you have not kind of have access, you can go to the website and email one of us in Waverley Care, and we can take it up.
Yeah, and I think that's very important, because like mother to child transmission of HIV, well, a lot of these things that we're talking about today, we're going to be talking about in detail. But the new thing in Scotland now is PrEP is available now for anyone who wants it or who needs it. So that's the new PrEP guidelines. So, and it's free, absolutely free. So it means anyone can get access to PrEP now in Scotland from their sexual health clinics, which is amazing, So definitely, if you want more information about any of the things we've discussed, just go on Waverley Care, WAVERLEY, and then care, CARE. So www.waverleycare.org, and you'll be able to find out more information and also how to get in touch with us. We're coming to sort of the end of our show today, but like I said, we are going to be on every second Thursday between 2 to 3 p.m. Every second Thursday of the month between 2 to 3 p.m. So definitely tune in. We're going to be dissecting most of these things we've talked about, talking more about some of these specific things. So if you want to find out more information, tune in every second Thursday between 2 to 3 p.m. for Positive Health Hour. Also, there's things that are happening over the next month. World AIDS Day is the 1st of December. World AIDS Day is an internationally recognized time when we celebrate the achievements that have been made in fighting and tackling HIV and HIV stigma. But we also take this time to tell people about what testing is and how to get tested. So you've heard about testing today. World AIDS Day is a very good time to go get yourself tested. So definitely get tested on World AIDS Day. There's also going to be an online event hosted by Waverley Care, and this is for minority ethnic communities in Scotland. You can find out more information about this event on our Instagram page at Waverley Care or from our website. Also, if you want to get access to free condoms, if you're out and about Glasgow city centre, drop into the Calabash restaurant, and you'll be able to get free condoms in the bathrooms. We always top them up from time to time there, and they're free, they're confidential. Just take one while you go for your bathroom business, and that's what's available for us from now till the next time we're going to be here with you. Thank you so much for listening to us. Thank you so much for calling in with your questions as well, and we're looking forward to talking with you guys again next month.